Over the last 2 years, CARE has almost tripled in size. Our impact in the community has significantly grown. The future is bright for us as we continue to expand our services and help people, whether it's through our parenting programs, our peer recovery coach program, or our employee assistance program.
My name is Cindy Jensen, and I am mom to 4 amazing kids with autism. My kids vary from severe, aggressive, and nonverbal autism all the way up to having Asperger's. I first heard about CARE when my daughter was in a special needs preschool, and my friend was running the preschool, and she kind of encouraged me to take the parenting class. And at the time I thought, it's not going to connect. My kids were special needs. I went to the class, and I kind of had some reservations about it still, and I was skeptical when we were learning things like iMessages and reflective listening. So when I took my first parenting class, my oldest was probably about 4 years old. Since then, I have taken about 10 parenting classes through CARE, no exaggeration. I'm not a slow learner. I learn something new every single time. The second time I took the class, I saw that I was using these things and had no idea that I had built this into my parenting skills with my kids. The thing that I learned the most from was probably the reasons for misbehavior. I could look at my daughter, who's nonverbal, and see what her behavior was, how it made me feel, and then take the emotion away from it and determine what I needed to do to help her to not act that way or to feel better about herself. And without those CARE classes, I wouldn't have understood that.
We've been invested with CARE for the parenting conference for a long time because promoting the community's health is foundational with things like diet, nutrition, being brought up right, having a peaceful, nonviolent home, avoiding habits that are harmful to one's health. And so if the goal ultimately is the top of the pyramid, is to have good health and a healthy and productive community, you really have to start with the things that are foundational, like love in the home and having good, healthy behaviors.
One of the things that makes me most passionate about the work of CARE is my personal connection to our mission. When I was growing up, my mother struggled with an addiction to heroin. For much of my life, she was homeless, living on the street. I didn't know when the next phone call that I would get would be a police officer saying that she was dead, her calling and asking for money. As a child, I would go in and out of different hospitals, healthcare systems, emergency rooms, and see often the utter disdain and disgust in the look of different medical practitioners' eyes when they were treating my mother. And as a child and as a teenager, that was really awful to see. I also had the blessing at certain organizations and different healthcare professionals seeing the difference it made when somebody treated her as a human and with dignity and respect. Thankfully, my mother now has over 15 years of recovery and is able, and we have a strong relationship that took a lot of work to rebuild.
When I discovered drugs at the age of 12, 13, I finally felt that sense of belonging. I spent 30 years in active addiction, in and out of institutions. I thought that my life was completely over, but to my surprise, it was the beginning of my life. I'm Jeannie, I'm a person in long-term recovery. I got clean in 2015. There was just this light bulb that came on finally. I remember sitting in prison thinking to myself, maybe I should go to college. Maybe I should be help other people that have drug problems. I wanted to be a counselor. Well, today, I'm able to do those things because of recovery.
I think CARE is unique in that they are with us on the front lines. It is not a referral after the fact type of process. They are very active and seek out patients who need to be in recovery and offer them services and create opportunities. The care coaches have become a part of the fabric of our department. They are part of the treatment team. So my team medically, the physicians and nurses take care of the patient first, and then we bring the care representative in to start their evaluation very early on in the stay. And again, it affords them an opportunity to find help that they need, help that's not always well provided by medical facilities, and an additional resource.
A peer recovery coach is a mentor, a cheerleader, an advocate, someone to help somebody to be more self-sufficient, to be that person that says, yeah, I've been through that and there's a way out of that. When I started working in recovery in 2016, this was the place that I really wanted to work. So CARE was like the goal to get to.
You know, our first experience in working with CARE was on the Ride for Recovery, and it's really to both support people that are in treatment and recovery, and also to celebrate the people that are in recovery. It's really something too our employees enjoyed, and we have a lot of folks who are competitive when it comes to events like that, and so that's been a fun way for our employees to become engaged too. HAP chose CARE as a partner to support in Southeast Michigan because we really feel that their mission and vision align really well with ours. Helping to make sure the community is healthier and happier is really at the heart of what we do at HAP. We can look at CARE as a partner that we can, confidently refer our patients and members to for assistance, and that's a wonderful thing to have.
Some of our other expansion work, I am excited to announce that we are starting a new employment program at the organization. We're starting a new program called Individual Placement Support, and we will have employment specialists on staff at CARE helping people who have a history of addiction find and maintain employment. Some other new exciting work that we're looking forward to doing is we're expanding our successful emergency department peer recovery coach program to urgent cares. I would like to thank our corporate partners this year, First State Bank, Ascension, and HAP. We couldn't be able to do the work that we do each and every day without your support and the support of hundreds of supporters, donors, volunteers, board members, and our staff that are on the front lines each and every day delivering services.
The great benefit that CARE provides to our community is they're there for anybody who needs them. When you're struggling with a very difficult problem, your first attempt doesn't always work. You have to keep picking yourself up and keep trying. And the thing that I really like about CARE is through each one of those steps, they're there for you. And they don't give up on you. If you're at a period in your life where you're very stressed, or you're going through a trauma, CARE can help you through that. And that's a wonderful thing. You're not alone. All of us have gone through stressful times. All of us have gone through traumas. Don't be afraid to reach out for help. And if you don't have that built-in support group, don't hesitate to reach out to CARE. They will do everything that they can to help you through whatever kind of difficult problem you're facing right now.